Hi, my name is Dr. Mark Halpern, and welcome back to my series of short videos in chiropractic care. Today we're going to discuss two things. One is, what type of technique do I use? And two, what does a typical adjustment or a typical visit involve? In my opinion, the more tools in your toolbox, the better. The more I can adapt to each of my clients, the more techniques I know. For the most part, I use 2 or 3 primary techniques. The first is called diversified, the second is called Thompson, and the third is called AK, or applied kinesiology. I additionally use something called psych-k, or psychology kinesiology, to help remove subconscious beliefs if that's part of the issue in my client. Each visit we will go through a typical adjustment. We may discuss exercise or lifestyle issues, as well as any other concerns that they may have. The purpose of each adjustment is to create balance in the nervous system and break any developing neurological patterns. In a previous video, I showed you what I thought a typical neurological pattern could be, and just to refresh your memory, if you take your hands and you put them together, most people will have a dominant thumb, one that is over the other, and no matter how many times you do it, you will always have that same thumb on top. That's a neurological pattern that has been developed. And if you want to break it, it will take repetition and practice doing it the other way to create a new neurological pattern. And that is essentially what we're doing with the nervous system here, is finding patterns and breaking patterns to allow the body to heal, adapt, and function properly. So I'm going to take you through a typical adjustment using something called leg length analysis, which will tell me about any irritation in the nervous system or strain on the nervous system. So with the patient on the table, the first thing that I'm going to do is look for the leg length if there is an inequality. You can see from this view that the left leg is looking about half an inch to an inch shorter than the right. Please look to the right. You can see now that those heels even out, and look to the left. And you can see that it goes back to being short. So please look back to the right. This indicates that there is some type of irritation or pressure being put on the subluxated nerve. Look straight down. And what we're going to do is adjust using something called a drop piece. The drop piece will fall, allowing me to use less rotation and less force. After each adjustment, we will come back and check. So you can see, hopefully, that the left leg is still short. I want you to look to the right and look to the left. You'll see now there is no change, meaning that we took the pressure off of the neck and there's nothing left in the neck that's going to help us balance out the spine. Look straight down. The next thing we go to is a primary area, which is the pelvis. And because it is rotated to the left, we're going to rotate it back. So if the pelvis was tilted like this, I'm now going to contact the sacrum and tilt it back the other way. Again, using the assistance of the drop pieces allows me to use less force. And then we're going to come back and check again. So you can see it's better, but it is not perfect. So we go to another primary area, which is the lower lumbar area, and we're going to contact the spinous process and move it back to the knee, and then come back and see if there's balance. Well, clearly you can see that the heels are now balanced. After we have done that, I do like to do a few cleanup procedures, which is through the mid-back, which is where a lot of people get irritation and tenderness. And I may do a few adjustments in here if necessary. Again, using the drop piece for some ease of movement. Okay, it seems like everything else is balanced. We still have balanced heels. Can I get you to lie on your back? I'm now going to use the other technique, the AK, applied kinesiology, to just make sure that there is no neurological noise happening in the ankles, knees, hips, wrists, elbows, or shoulders. I'd like you to hold that out nice and strong. And we're going to hold this out. Quite the difference. Try this one again. And out here. Okay, so there's a bone in the foot that we have to adjust. And we're going to bring that down. Hold that out now. And again, you'll see that the power has come back on. Bend up this knee. Doing a quick check. Pull backwards. Just to make sure that the joints and muscles are turned on properly and the messages are getting there. There's also a wrist that's out of alignment, so we're going to adjust the bones in the wrist to make sure that we keep what's called the carpal arch maintained well. I know some of you might get carpal tunnel syndrome, so this is one way of preventing it. Press backwards, and now nice and strong. And then the last thing we want to do is check the other wrist, elbow, press back, shoulder as a quick process. Okay, so that is a typical adjustment. If you have any questions about this or anything else, you can always find me at www.thetorontochiropractor.com. Thanks, and see you next time.